In this in this position, he provides technical assistance to the ag programs and Food for the Hungry's 18 country offices and collaborates on the development of grant proposals. Sam has a master's and a PhD in ag education from Texas A&M University. And upon graduating, he served as a visiting assistant professor in the Department of Ag Leadership, Education, and Communications at Texas A&M. Prior to his graduate studies at Texas A&M, he worked in Zambezia province in Mozambique on an ag development program for the International Mission Board. Dan will be speaking to us today about a project they're working on in the DRC on behavior change and ag nutrition linkages. Sam, welcome, and we thank you for getting us started this morning.
Good morning. Can everyone hear me now? You would just indicate in the, okay, perfect, yes. Well, good morning, good afternoon, good evening, wherever you may be. Thank you for the opportunity to share with the Helen group today regarding agriculture and health nutrition focused curriculum within a behavior change framework. And though the title slide does not reflect this, the vast majority of what I'm going to share today pertains to our USAID Title II program in DRC. So the target audience for our agriculture and health nutrition curriculum is characterized by low literacy and small land holdings. And really the low literacy component is one that, oops. Okay, I'm going to go back. The low literacy component is one that we have to contend with and create a strategy for being able to address and be able to raise capacity of the farmers and households to improve production and to be more healthy, have more nutrition in their diets. The means by which we do this is through visual flip charts and participative activities in order to generate discussion and group cohesion so that there's a forum in which participants can share ideas and can learn from each other and spur each other on to grow and to adopt new and improved behaviors and practices. These cascade groups meet every 2 weeks, and they provide a forum for following up on commitments made in previous lessons, as well as the presentation of new improved practices and behaviors. And the next 2 slides show one of them, this third one, this current slide that you're looking at, is a page from the flip chart, from a flip chart, in which we have sought to bring up foods that prevent malnutrition. This is actually from a module on gardening and raising small animals. And this is toward the beginning of the flip chart. And what you see here on this slide is actually 2 pages. The page on the left side is what the facilitator is looking at, and the page, the section on the right side with the 2 families sitting down to eat, it's a comparison picture, is what the participants in the program are actually seeing. And so as a result of this flip chart, then it generates discussion because they're looking at the pictures, and the facilitator has the guidance provided on the back side of the flip chart that ensures that he or she then presents all of the information that needs to be shared with the participants. So I'm going to pause for a moment and give about 30 seconds for you to scan the narrative as well as the picture, because it may raise some questions for you later on. And one thing I do want you to note is the question in the narrative, the very first question. It says, "What do you think these pictures mean?" And the rationale for asking this question, or the strategy, is even to ask the question, "What do you think these pictures mean?" And that gives the participants the opportunity to just look at the picture, to mull it over in their own minds, to discuss, and then based on the knowledge that they have in their prior experience, then they share what they see. And then in addition to whatever the participants have shared, then the facilitator shares the additional information. An important component of our curriculum is the use of cascade groups. And I would like for us to, as we analyze this slide, to begin on the right side where you see the red houses. The meaning of the red houses is that these are participant farmers. And the participant farmers in groups of about 12 to 15 will select that they're self-selecting groups. And then from amongst themselves, they will select a leader. And this farmer leader then becomes a part of an FLG, a farmer leader group, composed of other farmer leaders. And it is through this medium that the FH promoter, whether it's an agriculture promoter or a health and nutrition promoter, they then work with the farmer leader groups, the larger groups. Those farmer leader groups receive the teachings through the flip charts, and each farmer leader has their own flip chart. They then return to their community, to the 12 to 15 people who elected them as their leader, and present that information. Through this cascade group approach, we are able to have at least a 90% coverage rate in these communities in which we work. And that will then allow for a sizable contribution to the livelihoods of the communities. The question is, I am curious to learn what the literacy rate is. Whatever it is, it's quite low. I do not have an exact figure for you off the top of my head, but I would venture a guess that it's maybe 20 to 30%. And that also raises the question about the literacy rate of the lead farmer. It does need to be someone who has some degree of reading skills to be able to lead the group, and that is one of the criteria. So an integrated curriculum that addresses agriculture and health and nutrition. No one single module is going to be able to address all of the agriculture and all of the health nutrition messages that we seek to convey and to have populations adopt. But we have adopted, are using a module approach on various topics, and the next slide actually addresses what some of those topics are. But a mechanism that we have employed in order to provide feedback to ensure that our program and the curriculum integrate health and nutrition messages and agriculture messages in each module is that when a new module is tested, we have health and nutrition staff participate in the feedback session, as well as when the training is provided on a new module, meaning prior to the final printing. This would be a final draft version, and we train based on the final draft, get final approval from the agriculture and the health and nutrition staff participating, and then at that point in time, print the materials. So this ensures having an integration of ag and health nutrition messages within each module. So these are some of the topics or some of the modules that FH is addressing in our Title II program in DRC. Goats, chickens and guinea pigs, kitchen gardens, fruit trees, staple crops, and these also overlap with existing modules from the previous Title II program, our MyApp, the essential nutrition actions and essential hygiene actions and complementary foods and micronutrients. Okay, Mary DeCoster from TOPS and FH writes, the literacy rate for the DRC is at about 67% overall, but probably much lower in some rural project areas. I would venture a guess that it would be half that in the rural areas. But again, that's my own personal estimation. So the focus really of our discussion this morning, what I'd like to spend the remaining minutes that I have, is to look at the vehicle by which we present health and nutrition and agriculture messages within the flip charts. And we use what are called facilitation cues. And these are the 7 facilitation cues: attendance and troubleshooting, ask about current practices, share the meaning of each picture. The 4th one is a demonstration or a field visit or a group activity, a discussion of ways to overcome the barriers, practicing and coaching, and then finally, request commitments. I think it's also quite important to point out once again here that each of these groups will meet every 2 weeks. So there is a recurring pattern of asking about the current practices, sharing pictures, demonstration, finally ending up with a request for commitments, which then 2 weeks later, at the beginning of the session, what is it that you actually do during the attendance and the troubleshooting? You follow up to find out how have you done with the commitments that you made before this very group, and try to figure out if there were some trouble being able to fulfill those commitments. What could someone do differently to be able to overcome those and to learn from each other? So let's look at each one of these facilitation cue steps. You may note that at the top right corner, I have inserted an image. This is the image that is included on the flip chart and in lesson plans to get the attention of the facilitator as well as the participants, that they know what's going on here, whether they can read or not. Attendance and troubleshooting. After taking attendance, which normally doesn't take but less than a minute, the facilitators discuss any difficulties farmer leaders have had in teaching previous lessons and help them overcome the teaching challenges. And really, the most important aspect of the attendance and troubleshooting is to hear about the accomplishments since the previous lesson. This is both on the end of to congratulate those who have accomplished their goals, as well as to encourage those who did not accomplish their goals. Let's find out why. What were the challenges that you faced? And see if there are any potential solutions from among the members themselves. I see Herbert has a question. Are training evaluations for the trainings at the group level? For the trainings at the group level. Herbert, I'm not quite sure I follow your question. Perhaps, Herbert, why don't we come back to your question at the end? Okay. So, the next facilitation cue is asking about the current practices. You may recall that on the slide where I showed an illustration or an example of a flip chart page, I highlighted the question, what are your current practices? And the reason that we ask about current practices is to show the respect that is merited by the participants, because all of them come with knowledge on these topics. We don't need to assume that they have empty brains or lack experience, but rather we're building upon what they already know and can encourage learning simply based on the discussion of what they know. Then share the meaning of each picture. You may recall that I showed the slide of the example of the flip chart page, and I highlighted the question, what do you think these pictures mean? Which allows the participants to discover the content themselves and to discuss amongst themselves. It's only after they have discussed what they perceive to be the meaning of the pictures that then the facilitator will read the captions on the back side, ensuring that the key messages are shared. So at this point in time, once the meaning of each picture, and normally within a lesson that lasts about 2 hours, there are 4 or 5 of these pictures. And this is the point, slide number 3, the sharing of the meaning of the picture, is the last of the last time within a session that they are actually actively using the flip chart until the very end. Okay, so there's a time period where there's some application and the flip chart is not used, but they will return to using the flip chart. So let's look at what happens next. And that is a demonstration, a field visit, or a group activity. We know from social science experiments that participants remember 20% of what they hear, 40% of what they hear and see, and 80% of what they hear, see, and do. Therefore, we must, in any sort of teaching experience, have some sort of hands-on learning opportunity for the participants to truly interact with what has been shared with them. So each participant is encouraged to try out the new teachings. And most of the time, specific materials and preparations need to be taken care of before the session begins. So for example, actually, if you're going to teach a lesson about preparing a nursery or vegetable seedlings, then this is the point at which you would actually go through the entire process showing how that actually works. Another example would be show and tell on improved harvesting and storage methods of seeds and tubers. The point is to give the participants an opportunity to try out the new teachings. Then, this is a really interesting point within a session, because once all of the information has been laid out, they have actually practiced it in the previous step, then the question is asked, is there anything that might prevent you from trying these new practices? And it's a moment for them to really take stock of what has been taught and whether they are willing to adopt it. Now, does a participant need to adopt everything that is presented all at once? No, they may decide, I will do one of these practices, or I'm going to see how the others do with adopting the practices, and I may adopt it at a later time if it works out for them. But the point is to give a forum for the group to discuss what are the issues that they may have with overcoming the barriers that they think of that they may face. Then this is the point during practicing coaching where they actually pick the flip charts back up again and use them to practice teaching the material in pairs. So remember, going back to the cascade model presented earlier, this is the point at which the facilitator is with the farmer leaders, and the farmer leaders have heard the information, they've practiced it, and now they are actually with their own flip chart teaching it to another person within their farmer leader group. Why is that absolutely necessary? This is a critical step because any time that we have participated, us personally have participated in a training, how often have you attended a training and said, yeah, that sounds really good. Wow, that's fantastic. I'm going to do that. And you get back and it's time to implement it, and you're really not quite sure that you remember everything that you were told. Does that happen to anyone other than me? Raise your hand or give me an okay whether that happens to you. Has happened to you. Absolutely. Yes. Okay. So this is an opportunity for the facilitator to ensure that the participants, the farmer leaders, are actually understanding the information, and they can then, if they have a question, something that they're not sure about, that they can ask the facilitator and ensure that everyone is on the same page, everyone understands, and they may then return to their communities and provide this training to the 12 to 15 farmers who elected them to provide the training. And the final step in the facilitation cues is to request commitments. It's interesting that the farmer leaders, when they are in their farmer leader groups with the FH facilitator, they're asked, you make a commitment. Because let's remember, they are leaders, and they've been elected to not only provide the training, but others are watching and seeing what they do. And they, in turn, can then request commitments of those who elected them to provide the information. So each farmer will make his or her verbal commitment to the others in their accountability group. The key, of course, there is making it a verbal commitment. If they were to make a commitment in their heart of hearts, they may have a greater difficulty in fulfilling it. But because it is verbal in front of the entire group, they are held accountable. Accountability is helpful in the sense that they can encourage each other to take on new behaviors, new practices, and stimulate each other. Again, a point that I raised earlier is that these groups meet every 2 weeks, and as a result, there's a consistent follow-up that will enable them to fulfill the commitments that they've made. I'd like to highlight 2 examples. I commit to talking with my spouse about making space near our house for a kitchen garden and animal hutch. And the reason that I included this particular one is because our ag and nutrition curriculum must also entail and address gender issues. I think that the strategy that FH has used on agriculture and health nutrition programming concerning curriculum is that gender is woven in throughout the entire modules. It's not a pull aside, it's not a set aside topic, but it's incorporated throughout. In the examples, especially in the illustrations, every opportunity that is presented for a man and a woman to be in the picture together. So the husband and the wife are in the fields together cultivating. The husband and wife are harvesting together. They're drying the fruits and vegetables together, and so on. So it generates this idea of men and women are doing the work in unison. I see that there are some questions. Emily says, so the FLG learns all the information and then delivers to their group, or do they learn one lesson and then deliver to the farmers on a more iterative basis? Yeah, okay. Mary has answered that question. It is done. They learn one lesson and then they deliver it. 2 weeks later, they meet once again with the FH facilitator who gives them another lesson, and then the farmer leaders return to their communities and deliver it, and it goes on in that fashion. And Emily also asked, in your experience, are most of the leaders men? Our experience has been that it's about 60-40. We try really hard within the agriculture program to have equity, gender equity, but it's very, very difficult to find groups of men who will elect a woman leader to give them the training. That being said, prior to the formation of the groups, we actually give a fairly good sensitization of the need to have women leaders. And as a result, like I said, it's about a 60-40, where 40% of the leaders in the agriculture curriculum are women. So Joseph says, have you rolled out the training in other countries? If yes, is the experience similar? We are in the process of rolling out to other countries. We actually use the program in DRC as a follow-up to our program in Mozambique, our Title II program in Mozambique, and we improved it. So we're hoping that in other countries that we will have lessons learned and we'll make improvements to what we're doing now. I'm afraid that if I continue asking questions, I'm going to take up the other presenters' time. So I'm going to stop here, Ashley, and if we have time at the end, I will come back and answer your question. So I'm going to pause here for now. Thank you.
Hi, Eric. I don't know if your mic is muted, but since I'm not hearing from him, I thought I might just step in and introduce Ramona Ridolfi. Ramona, is your mic working?
Yes, Ramona and I are both here.
Hi, Erica.
Hi. So yes, I'm Erica Katran. I'm the country director for HKI in Bangladesh. And the main presenter here with me is Ramona, who is our gender advisor based in Bangladesh.
So hi everyone. Thanks to the Nalang for allowing us to present today. So basically, I will be going, in this presentation, I will be going through a brief overview of gender discrimination in South Asia and Bangladesh in order to better understand how and why we design specific gender interventions in the country. In particular, we look in detail at our latest gender transformative approach implemented through the Nurturing Connections curriculum, which is a new integrated gender and nutrition package. And finally, we will draw some conclusions on what transformative gender approach means. Gender discrimination is a primary underlying cause of malnutrition in South Asia, resulting in high rates of women's malnutrition and poor feeding practices across social classes. For example, tradition wants that women and girls are almost always the first to reduce their consumption during household food scarcity. And in Bangladesh, for example, 20% of adult women aged 19 to 49 and 42% of adolescent girls aged 10 to 18 are undernourished, as estimated through body mass index. 1 in 4 pregnant women are so thin that their babies are born small as a result, and 20% of child stunting is likely to begin before birth. So what is the solution here? At HKI, in our experience in Bangladesh, we have seen that increased women's status leads to increased negotiating and decision-making power. When women have decision-making power over expenditure of income, investment will be directed more toward food and education. This means that women can use their increased negotiating and decision-making power to positively affect the food security and nutrition status of the family as a whole. If you all look at this graph, that has data from a World Bank report in 2010, it shows that women's empowerment can have direct effects on nutrition outcomes. The report, in fact, says that maternal education directly affects the mother's knowledge and ability to care for the children, either through formal cash earnings or participation in decision-making regarding purchase and healthcare. Women are able to provide healthier environments conducive to children's growth. Women education, in particular, influences women's status and vice versa. Other contributors to women's status include income, possession of assets, and societal values. So with regard to the specific situation in Bangladesh, the relationship between maternal stunting and increased risk for child mortality and growth retardation is complicated by high rates of child marriage and adolescent childbearing. Child marriage is the hot topic in Bangladesh at the moment. According to the Plan International latest report issued last September, the child marriage rates in Bangladesh are the 3rd highest in the world and the highest in South Asia, with 60% of women currently aged 20 to 24 who were married before the age of 18. And it is illegal in Bangladesh to be married before the age of 18. Here on this slide, I put a graph with data from DHS in 2007 that shows, for example, how Bangladesh has the highest rate in South Asia as compared to Pakistan and India, with about 21% of 15 to 19-year-old females who had been married before the age of 15. So what is the problem with child marriage? Tradition wants that when women are married, they must have their first child within the first year of marriage. So early childbearing among undernourished adolescent girls can lead to maternal mortality and compromised health and nutrition for both mother and child. So what has HKI done to address gender issues in Bangladesh? In its 35 years of experience implementing nutrition, food security, and blindness prevention programs in Bangladesh, HKI has observed that traditional gender norms hinder women's development and children's well-being across sectors. So we started with a very simple gender focus back in 2008 in our real project that came just following the cyclone Cedar, and we involved women in some horticultural training, just making sure that gardening wasn't a time burden for them, and we made it easy for women to access the expertise in the community. With Project Laser Beam in 2011, we started to enhance women's food security, bargaining power within the household, and ability to access and negotiate markets. And a mid-project assessment indicated a positive association between AGAs and women's increased decision-making on child's nutrition. Finally, last year, we actually developed a gender transformative intervention in our project BEAM, Building Equity in Agriculture and Markets in Northwest Bangladesh. And in this project, we elaborated an integrated nutrition and gender package with challenges discriminating gender norms in the household, which often lead to malnutrition in Bangladesh. So now let's have a closer look at what this Nurturing Connection curriculum is. It is inspired by Stepping Stones. I'm not sure how many of you are familiar with it. Stepping Stones is a training package that was developed between 1993 and 1995 in Uganda to help communities talk about gender power relations and highly sensitive topics, which are the underlying causes of HIV and AIDS transmission. So basically, we took the same approach of Stepping Stones, working with three stakeholders groups, in this case women, their husbands, and their in-laws, which are the main decision makers in the household in Bangladesh. These participants discuss one topic, the same topic at the same time, on the same day in their own separate peer groups, and at the end of a thematic block, we select randomly 5 participants from each group, and they discuss in a mediated community setting. At the same time, besides the Stepping Stones approach, we drew from our own HKI materials on nutrition and gender integrated activities to empower women and improve their health and that of their children. So the aim of this curriculum is to challenge the intra-household inequality that cause food insecurity and malnutrition, such as discriminating practices for which women must eat the food last, even when they're pregnant, for example. And as these topics are often quite sensitive, it is difficult for participants, especially women, to talk about private relations. The curriculum has activities that help participants build skills in communication, assertiveness, and problem solving so that it's easier for them to discuss about these sensitive topics. Let's have a closer look at the content and design of this curriculum. So it has blocks, as I said, which are basically thematic modules. The first one is about communication skills. Then we try and understand different perceptions in the house and gender. We negotiate power relations, and we act for change. If you look at the picture, this is an example from block 1. It has a set of activities. And activities have been divided into days depending on the length. So we try and structure them so that we have a maximum of 2 hours in the community. And at the end of the block, we have a community session where some participants will share the learning from the block. Every activity starts with an action or an experience. That means we have a role play, we have a game, we have a storytelling. We always try and make it fun and entertaining to keep the attention. The action is followed by reflection. What happened? What does this mean? We analyze the context. Why do we have such practice in this area? From the reflection, we draw a learning and we name it. That could be self-respect, that could be understanding others, active listening, and the learning leads finally to a planning. So now what? How are we going to improve the situation in the house? This is an example of one of our favorite activities called Access to Nutrition. So we start the activity by getting 6 participants to play the role of a family who is about to have dinner. And we give the wife a certain amount of food and we ask her to plate the food. And in most cases, we've seen how she would give most of the food to the husband and the son, then some to the in-laws, and finally just leave some rice for herself and the daughter. And so from this practice, we start discussing on why we have such behavior, where does it come from, why is this unhealthy for the mother and for the children, and what can we do to change it. So, as I said before, this curriculum has just been implemented in our BEAM project in Ulfamari, Northwest Bangladesh. We just finished the implementation, and while we're waiting for the final evaluation, which will happen next month, we collected some case studies of positive behavior change in the communities. And here, for example, we can see how husband and a mother-in-law after receiving the training, understood how the huge housework that the women face every day negatively impact the ability to care for themselves and for the children. And so after this training, now they've started to support the women in the household tasks so that they can concentrate on the nutrition of themselves and the babies in the house. So let's draw some conclusion on HKI's approach in gender in Bangladesh. Maternal and child nutrition interventions are traditionally built on a paradigm that views them as an entirely feminine responsibility. They're built on what we call in gender studies practical needs, such as access to healthcare, improving nutrition, but we do not consider the time burden issue for women, and therefore that can increase barriers to optimal child feeding and self-care practices. This happens because they do not challenge the gender norms or address women's strategic gender needs of equality and empowerment. HKI instead has developed a specific gender approach that promotes the transformation of these discriminating gender norms and social habits. Nurturing Connection, in fact, targets all main decision makers of the household, not just women, not some of the husbands, but we target especially the mothers-in-law because in this country they have the highest say of women's mobility and breastfeeding practices. And so in this way, we target the strategic interest of women, and at the same time the curriculum is facilitated in conjunction with small-scale and agriculture activities that increase women's knowledge, skills, asset ownership, income, and mobility. So in this way, our curriculum is innovative and can be adapted for use in different contexts. Nurturing Connection was elaborated in English, has been translated into Bengali, and we made some minor adaptation to the activities depending on our context, on what is acceptable in Bangladesh. So in the same way, it can be reused with an appropriate translation and adaptation to the content. And if you would like to see more information, at the moment, Nurturing Connection is participating in the World Bank Harvesting Nutrition Contest, so you can access more information on the following website. So just to summarize, what does it mean to have nutrition and gender lenses? First of all, the key to address malnutrition and food insecurity is to challenge the intra-household power disparities. We need to focus not on the practical needs, but on the strategic interest of women, which means increasing their ability to take self-care, to be able to recognize their own health and nutritional needs in a context where they're normally taught not to have any. To allow them to have their own reproductive control. They should be able to say when they want to get married, at what age to have the first child, and support them in their independent financial control to, enable them to have a say in minor household expenses and mostly to participate in joint decision making. To make all of this possible, we need to remember that our local staff have their own gender biases that need to be addressed. So a good, let's say, an excellent training of trainers is required. And mostly I would like to point out that doing gender involves attitude change. Behavior change requires time. We would recommend that this curriculum is implemented in a minimum time of 6 months. And to monitor behavior change, it is ideal to check for a period of up to 2 years following implementation. And so to conclude, I would like to mention this sentence by Amartya Sen: gender discrimination hurts not just women, but imposes a heavy economic cost on the society by harming the health of all, including that of men. Thank you.
Thank you, Ramona. Can everybody hear me? Patrick, can you say okay? Okay, great. At this point, I'd like to open up questions from the group to both sets of presentations. To get us started, I'd like to revisit Ashley's question to Sam. And Sam, that question is, does the project have a mechanism to respond when obstacles are structural? I.e., women don't have time in the day to add household gardening without taking away time from childcare. Or some women are dealing with gender-based violence. Sam, are you there?
Yes, can you hear me?
Yes.
Okay. You can hear me?
Yes, we can.
Okay. All right. So going back to the original question that I at the very end, 2 out of the 3. So the last 2, if I may scroll up for a moment, if folks would hold off on typing anything into the chat box. Okay. So Ashley, the 2 of the 3 that you listed there as examples, the last 2. Women dealing with GBV or ag inputs are inaccessible or unaffordable. Those are aspects that are directly tied to interventions in the program. So we deal with those issues head on. And then while the discussion has been going on, I've been thinking about this issue of women not having time in the day to add household gardening without taking time from childcare. Really, it goes back to one of the big elephant in the room types of questions as we deal with women empowerment, is how do we empower women without adding more responsibilities to their already heavy laden loads? And so I'm actually going to turn that over to Christy Tabah. Christy, can you go ahead and chime in at this time?
Okay, I hope I've unmuted all of my mics. Okay, it shows me talking. Thank you. First, just great presentations and really good discussion going on. And as Sam mentioned, this, I think this is a really big issue that as the discussions have and the dialogue has increased around, empowering women, we haven't really looked at time and labor burden. We often say, oh yes, and we must pay attention to this component, but we don't often actually put in any type of mechanism to make sure we're monitoring it, for example, once it's being implemented. And that doesn't even go back to the design phase. Where in the design phase, we should be thinking about these components. So I think it's a really difficult item to understand. We know that any type of activity that we implement, groups that we have, can have unintended implications and unintended consequences, and it's really context specific in terms of how people will respond. I mean, for example, in the HKI testimonials, we saw some really great feedback from participants, but yet we know probably from some of our own personal experiences with programming that not everybody reacts so positively to some of these trainings. They don't necessarily really grasp or they don't understand the true implications of what the information is trying to do, and that's probably could be our fault as presenters, as facilitators, but it also could be a lot of misunderstandings that are involved too. So I think there's a lot of factors that play into it. But we keep talking about how we need to be aware of the negative implications, not just for women, but for men too, and families. But I don't know if we're doing enough yet. And I want to turn it over, if Jen Williamson is willing to chime in here. I'd like to hear what she has to say, because I know she's been seeing a lot of programming and been focusing a lot on these types of topics. So, Jen, are you willing to provide some input? If not, that's fine.
Hey, Christy, can you hear me?
Yes.
Okay, thanks for that shout out. I don't know that I have a lot of additional comments to add at this time. So I do want to thank the presenters for their great information. So, but I do think that in engaging the local actors in this way and taking on, addressing what the local obstacles are and coming up with those types of solutions is an important way forward. Christy, did you have a specific question you wanted me to address?
No, I was just wondering if you maybe had any additional thoughts on this. I think we're all, in a sense, kind of in the same boat with, we're all recognizing that this is an issue, but we, unless whatever it is has been programmed, this is a conversation that you and I have had about, unless it's actually been put into the design of the program, it's hard sometimes to actually get it to move within program implementation.
Right. Well, one of the processes that we're looking at and implementing is, I think what's helpful here is that in these processes it's being built into the teaching and learning process. And I liked the question about both the subtle and the direct ways to address gender inequality. I think both can be very effective. But as Christy is pointing out, sometimes we've already started implementing a project and then realize that the gender hasn't been addressed or needs to be addressed. So we've been working out methods for looking at really how gender is impacting our ability to achieve project objectives generally. So taking a step back and helping staff and beneficiaries work through this process of understanding how gender really is a community process. And I think that was what was very helpful about both Sam's approach and Ramona's approach that you were sharing, is that it is that perspective in both cases of looking at who is at the table, who is discussing, who's having a voice at each stage. So there are processes for looking at the overall objective. The overall objective is improving nutrition. The overall objective is improving agriculture and food security. But then looking at the different steps that it takes to how are these social and community dynamics impacting that, and finding different ways in. So I don't know if that helps with the clarity, but there are different steps for doing that, and looking at when men and women are, engaging in these family and social dynamics, helping them have that discussion with each other and see the ways in which their relationships impact those overall objectives is very important.
Thank you so much. Ramona, there's a question posted by Suzanne. The question is, does Helen Keller International Program involve actors beyond the family, such as local policymakers and higher levels? Is there a feedback and retro-feedback mechanism to intervene as well as the social environment?
So I was just responding on the chat that in our first implementation of Nurturing Connections, we haven't involved policymakers, and that's mostly because the curriculum itself is very much focused on the household, because that's where the day-to-day decisions are made. However, we are looking into potentially involving, say, national nutrition services or policymakers at national level for a potential scale-up of the curriculum.
Oh, great, thank you. As we start to hit about the hour mark, before people start to drop off, we want to thank everyone for joining this morning or this evening, wherever you may be joining from. We encourage you to join on the FSN network, the Nailing Group. But also, we're going to continue to answer questions and keep the line open, so we encourage you to stay on and have discussions. But I just wanted to make sure that announcement got out there before people started dropping off. So are there any more questions or discussion points at this time? Patrick Bell, did you have a question earlier that you could repost? So Patrick asked, what have you found to be the most effective way to address resistance from men/husbands to women's empowerment?
I'd say educate them. So involving them in the training, that's one of the main reasons why we wanted to involve men and fathers-in-law as well, so that they can understand, they know what we're providing the women with, and they can participate in the learning as well.
Interesting, great. And
I would add that we also...
Just go ahead, Sam.
Yeah, I would add that something that we have done, not only in FHDRC but elsewhere, is to have champion fathers. So fathers who are willing to take on the additional responsibilities and become champion and models, and to share that experience with others. And these farmer groups, as well as the care groups, both of these using the cascade approach, is a very effective medium for having the champion fathers to share their experiences.
And as a follow-up, Patrick asks, is there no resistance?
No, I was just typing that in, but to be honest, we haven't really experienced major resistance from men. I guess probably the major point of this curriculum is that the activities are quite fun, and we don't deal with the issue directly. We, through these fun activities, through these games, this role play, we talk about daily experiences. We kind of go around the problem until we get to the point. So we don't, it's not a kind of, attacking behavior that we just go in the community and just get them to tell us about their experience directly. And so in our first implementation in Northwest Bangladesh, we haven't really found any resistance. The curriculum was actually well welcomed, and we've been asked to go back.
Yeah, and the exercises really focus on drawing the discussion out of the group itself. So it's not facilitators coming in and giving them a message about needing to change their behavior, directly. It's really providing an opportunity for them to identify what the changes are. And that's also where the peer group becomes very important, because when there's enough people saying the same thing, that kind of pressure is there.
And Jen, you raised an interesting point. I was wondering if you could expand on your comment on fathering champions.
Sure. We actually did a gender assessment, or I guess you could say almost a barrier analysis of a MyApp in Niger, because we had such low male participation rates in our nutrition activities and low female participation rates in our ag activities. And unfortunately, it was towards the end of the project, but we were really concerned about this disparity. And one of the things we realized was in asking all of these questions, the men were very interested in nutrition, but they kept saying nobody ever asked us, nobody ever invited us, nobody ever thought that we had a role in this, which for us felt like such a sad aha moment of so oftentimes we focus on the women, and these men kept talking so much about their role as a father and how they valued healthy families and valued healthy children, and they really wanted to take on that role of being a role model and being engaged. So they wanted to come with their wives to the nutrition education activities, and they wanted to also do things to support their wives' abilities to have home gardens and things like that. Another gender barrier we discovered was much more significant than we had realized was the mother-in-laws. So we found needs to reorganize our groups so that husbands and wives were attending sessions separately from mothers-in-law. So we found that in that particular area, engaging men as champions not only for their wives, but also giving men time to talk to each other about their role as fathers and supporters of these projects became very important in that particular activity. And we were sad that we didn't actually take the time or hadn't had the opportunity to do that information gathering until closer to the end of the project, but it was a very significant finding.
Interesting. Thank you for sharing.
Sure.
And Ramona, could you expand on Nasima's question to the entire group? Are activities always done with women, husband and mother-in-law together, as there could be trust issues if women are included in isolation?
No, so as it was mentioned in the presentation, they work in separate groups, even though if at the same time, on the same day, they work in separate locations, so they can't hear each other. And then at the end of the block, we pick some participant randomly and they share the learning of that block.
Great, thank you. Are there any other questions or comments at this time? Well, I would like to thank all our presenters, Pam, Ramona, Erica. Thank you for taking the time to share your expertise with us today. We greatly appreciate it. I'd like to encourage everyone to visit the FSN network. A lot of people have brought out great resources and great examples. We encourage you to share those on the FSN network. Post questions to the discussion group. We can all greatly learn from each other and what we're doing. And so we encourage you to use these resources. Also, fill out the survey that is on the screen. We'll use this to make everything that the Nailing Group is doing better so that it can better serve everyone in the group. And so at this time, we'll leave the line open if anybody has any questions, but we just thank everybody for attending today and hope you have a great day.